Patience of Reddit, what made you say how the f is this person a doctor? I had a urinary tract infection. I'm a male, and I made an appointment with my local GP, who was a female. I described my symptoms and said it felt like a UT, to which she replied, you can't have a UT, men don't get them cause men don't have urinary tracts clearly. So I made another appointment, had the necessary tests done, lo and behold I had a UT, and was given a prescription of antibiotics. It's certainly rare for a male to get a UT, but it's ridiculous for her to state that you can't get them at all. It's only really common in men who have like catheter bags and whatnot. My wife's grandpa has had a few over the past year or so, but again, as you said, uncommon but not impossible. Exactly. The first thing a doctor is going to want to look at is STDs when men complain of urinary pain, but any intelligent doctor won't fully rule out UT. She checked for other types of infections and also sent off my water samples to be tested for STIs, despite the fact I had informed her that I was using protection when she asked all the necessary questions. A week before my baby was due, the doctor, not my regular doctor, but a doctor nonetheless, decided to do an ultrasound because she couldn't feel where the baby's head was. Then she asked me if the baby had legs. I said yes, legs and feet. We had seen them on the 20-week ultrasound. She said, well, I don't see them, so I don't think this baby has any legs. I knew that my baby's legs didn't just fall off in there, and said exactly that to the doctor, or I would freaked out. The reason for this was that my baby was breech and facing into me instead of out towards the doctor, so her legs were tucked up under her body. My regular doctor said it was a common mistake, but I really don't think so. It could be a common mistake to not see them, but to state that the legs aren't there anymore when they were seen in a previous ultrasound? That's really stupid. Yeah, they totally didn't fall off in there. The ultrasound wasn't even necessary. She just couldn't find the baby's head properly, and I agreed to an ultrasound because I thought I'd get to see the baby and learn more about her, like her weight size. But the doctor couldn't tell me that either, so it was totally useless, and I'm sure it wasn't free. Oh well. Baby is happy and healthy, and I never had to see that doctor again. She was just the temporary replacement the hospital sent to the local office while my regular OB was on vacation, and she was an awesome doctor. I have been dealing with tonsil stones since I was 10. My mom took me to so many offices trying to get someone to take my tonsils out. They continued to refuse, saying I was too old. It continued to get worse as I got older. My tonsils became misshapen, swollen, lumpy, red, and extremely painful. I had to go have multiple tonsil stones removed by a doctor because they were so large. Last time I went in I was 18. At this point I was just begging for them to be ripped out. Once it was denied again, I asked if there was anything I can do that would make them a little better or the pain less intense. I've tried everything at this point, but I'm desperate. The doctor stood up, sighed, and told me, I can't help you. Living through extreme pain is just part of life. No one can fix this for you, so stop over exaggerating and deal with it. She left the room immediately after. What ent wouldn't take your tonsils out? It's done routinely. Are you in the USA? Yeah, it was a joke. And yes, I am. Dude, I went to my doctor last year and said my tonsils hurt from tonsil stones. Here's a picture of the last one that came out painfully. It was the size of the nail on my pinky finger. He referred me to an ent. Told the ent the same thing. His first words were, well, you can either live with it or I can take your tonsils out. I had a tonsillectomy within a month. You saw some asshole doctors. As is the story for many women with endometriosis, I went years without having a doctor take me seriously, and every couple of months during my teens my mum would hit another no, this really isn't normal patch, and take me to see a different doctor. The absolute highlight was a doctor at a walk-in clinic who had obviously attended a talk on depression. The consult went like this: the cramps are unbearable, I can't walk, most months I vomit from the pain, it's in my back and my legs, not just my stomach, I can't eat, ovulating also hurts so much, I can feel it. Do you do any extracurricular activities at school? UHH, yeah, I play the cello in the school orchestra. Do you play your cello when you have your period? No, I can barely sit up. Do you go out with your friends when you have your period? No, I can't go anywhere. Do you call them? No, I'm in too much pain. I think you have depression. Withdrawal from friends and social activities are classic signs. Kudos to her for taking an interest in mental health, but that's not the problem I came in with. I eventually got a diagnosis at age 22. I first started seeking medical attention for it at 11. I had a back problem, and when I was at the doctor's letting him do his thing with my spine, I turned round to see he had Google image searched spine and was reading off the screen to tell me where I was hurt and why. I got prescribed pain meds, and he literally said, "Is 100 enough? Would you rather 200? He also had to sign me off work for a while, and his exact words were, "So, a month? Or, should we say 2? I would have said 2 months and 200 meds. Oh, you better believe I did. My boss at the time was a really decent man and knew I'd actually been really struggling with it. He said I could either have the time off paid in full or paid a statutory rate, but he would pay for the MRI scan I needed. I took the full pay and got the scan on the NHS for free. It was a pretty good 2 months other than the miserable pain. If you could give me the name and clinic your doctor works at, that'd be great. My back suddenly started hurting. Came to my doc with an eating problem. Guy looked in my file and saw I was seeing a therapist. Said then there's no reason to see him. Turned out I had a serious medical condition impacting a lot more than eating. After treating it, didn't need to see a therapist. Thank God I know to take everything medical pros say with a very big grain of salt. I'm a therapist that works in a primary care office, and we always check for medical conditions that cause psychiatric symptoms first. Cause no therapy is going to fix your moods if, say, your thyroid is totally out of whack. Your doctor was an idiot. Went to the GP for some antibiotics for her infection. Standard stuff. Tell her I'm allergic to some antibiotics. Doctor gets annoyed because the one she wants to give me is one I'm allergic to. Starts questioning my severity to the antibiotic and wants to prescribe it to me anyway. I obviously refuse and name some that I have been on before. Go the chemist to get the subscription, and she has listed a different obscure name for the antibiotic she wanted to put me on. Wouldn't you know, I have an allergic reaction at work. Called the practice and told them she fucked up. You probably could sue. You could absolutely sue. As a pharmacy tech, I see a lot of stuff that just hurts the head that the patient never even knows about. One of the worst I've seen was an antibiotic for a 60-something man. The antibiotic in question can have a potentially fatal interaction with this patient's cholesterol med. So my pharmacist called the doctor about it. 4 phone calls and a half-hour argument later, the pharmacist just flat out refused to fill it. You know, because he found knowingly giving someone pills that would likely kill them objectionable. Crazy, right? The patient came in looking for this antibiotic. The pharmacist talked with him and explained the whole situation and why it wasn't filled. The patient then apparently went to the doctor's office and ripped him a new one. An hour later we had a new recipe for a different antibiotic for this patient. Edit typo. This is why I appreciate chemistry, but I feel bad for sucking at it. Hey, combine these two things and you get something that smells like bananas. Combine these two. Deadly neurotoxin. When my sister was dating her now husband, he developed this rash that wouldn't go away. They went to an urgent care and the doctor there told him it was bug bites, gave him a steroid injection and a prescription for steroids. My sister wasn't convinced and told him that they should have my mom, a pediatric surgical nurse, take a look. My now brother-in-law walks in, and before he can take off his shirt or say anything, my mom says, "Wow, looks like someone has chicken pox." She could see a few of the bumps on his neck. They get him into another doctor and sure enough, he had chicken pox. The new doc was not happy to learn about the steroid injection and prescription steroids suppress the immune system, the last thing you want for a virus. Told Bill not to fill it, and if it got worse they would call in an antiviral. I got an ECG done to determine whether I had Wolff-Parkinson's White syndrome or not. My doctor called me on a Friday and left a message saying, "So it turns out you have that thing," and proceeded to tell me that she would be back in the office Tuesday if I had any questions. I proceeded to have a series of panic attacks throughout that weekend. I have a feeling that their vague message was more of a precaution to preserve your privacy and less of a not caring. You can't exactly leave people's medical information in messages and such. At least that is what it is like in the US. I see what you're saying, but a way better approach would have been to ask me to call them back instead of just dangling it in an informal way. I waited weeks to see a doctor that I'd never been to before. I waited there forever to be looked at for a minute. I tried to explain the reason why I was there, but she just kept saying nope, you're fine, and actually walked out the door on me in mid-sentence without addressing my issue. I had to take more time off work to see my regular doctor, who was horrified I'd been treated that way and actually prescribed me medication to treat my problem. It's crazy that their job is literally to listen to you and help you as much as they can, yet some can't even take one moment to properly assess or diagnose you. I'm glad that other doctor paid attention to your needs. Thank you. When I came out of surgery with an ice pack taped to the underside of my cam boot, the surgery was on my ankle, the ankle enclosed inside the boot. Apparently I took one look at it in my doped up state and flatly said, "What the fuck, man?" They didn't give me an ice pack to bring back, so I used a frozen bag of Reese's until someone could get me one. Military medicine is one of a kind.